Seems like medical spas are everywhere these days, where you can get a massage, Botox, smart lipo, and your nails done all at the same time.
And the word medical typically means they're run by a licensed physician. But as Jennifer Stagg discovered, that does not always mean they're safe.
Bruce and Dini, we want to be clear. We're certainly not suggesting that every medical spa is unsafe or that you should have every procedure performed by a doctor and not an esthetician or assistant. However, doctors themselves brought this issue to our attention. They say some of their fellow physicians are performing or overseeing procedures in which they have little or no training in, and they want to see state regulation to stop it.
It seems so easy. The pinch of a needle, twinge of a chemical, sting of a laser, and you can have that smooth, flawless, toned skin and body you want, all during your lunch break. Just head on over to one of the dozens of medical spas in the state. The majority are run by doctors, licensed MDs. Patients assume they're in good hands. So why then are more and more patients walking away like this?
These people are really disfigured for life.
Dermatologist Dr. Paul Harrison regularly sees patients hoping he can fix their botched procedures from medical spas. He says just because a doctor owns or operates a spa doesn't mean they know what they're doing.
In Utah, any medical doctor can oversee any procedure. Now, usually the hospital helps regulate that so that a doctor doesn't just start doing brain surgery. But with things that are done as an outpatient, then anybody can do it in any office.
With the downturn in the economy and issues with health insurance, he says in some cases physicians looking to make quick money have opened so-called medi-spas. Some perform or oversee procedures they have little or no training in. Sometimes the physicians aren't even on site. They leave their staff to perform laser, chemical, or injection treatments and visit the office a couple of times a month.
In just a few seconds with the fire of a laser, the laser can go very deep. Lasers are destructive.
Carrie Jaramillo learned that the hard way.
It looked like a crater, like you'd go to Hawaii and see craters in the earth. That's what it looked like in my flesh.
Jaramillo went to a medical spa in her hometown of Price to have a couple of sunspots on her face lightened with a laser. The spa is run by a family doctor, and her procedure was performed by a physician's assistant.
It felt like somebody was burning me. Each pulse that she did, it felt like somebody was holding like a torch to your face.
She asked her to stop and was given some cream to put on her face. But Jaramillo was left with burns so severe, it took reconstructive surgery to repair them. She went to Dr. Stephen Mobley, a facial plastic surgeon at the University of Utah.
Really makes me quite angry because I've devoted so much of my life to providing good cosmetic care to patients. And now you have to take somebody with a young, pretty, scarless face originally, leave that patient with a scar. It's going to be a better scar, but still a scar. It's very disheartening because the whole thing should never have happened.
Dr. Mobley believes it's dangerous and unethical for doctors to perform a procedure outside of their expertise.
I think there's a gray zone. I often joke with some of my doctor colleagues that I know a lot of OB-GYNs that do Botox. I don't know any facial plastic surgeons that do C-sections.
Botched medical spa procedures are such a problem. A group of plastic surgeons and dermatologists is banding together, fighting against their fellow physicians. They've created a coalition and are pushing for legislative action.
We expect every physician to stand to that higher level and do what's good for patients.
Representative Greg Hughes is now looking at whether the state needs to step in and regulate.
We're going to see, look at the licensing and the practices of doctors in the fields that they're practicing in, and make sure that the public is truly protected.
Until that happens, doctors Harrison and Mobley say the burden of responsibility falls on the patient.
A patient needs to understand the difference between a massage and a pedicure and a laser treatment and an injection. And when you cross that line into a medical procedure, you just have to do your homework and know who's doing it.
Now, we contacted the Department of Public Licensing, who told us they don't have any statistics on how many botched procedures are performed at medical spas. Also, some doctors go through additional training so they can perform procedures outside of their specialty. The best thing to do is research on your own before you have a procedure done. Bruce, Dini?
Thanks, Jen. Make people more aware.